I am Rachel Tambo, and I'm a very proud patron of the South African Federation for Mental Health. The South African Federation for Mental Health is very proud to be hosting this World Federation for Mental Health conference in Cape Town. I am a true believer and supporter of all the wonderful work that you, the mental health fraternity, and what our fantastic Federation for Mental Health does. Mental health is surely the essence of who we all are, but is still the most highly stigmatized area of health today. The stigma attached to mental health may be more acute in developing countries, but the lack of understanding surrounding mental illness is a global issue. South Africa is probably the most highly resourced country medically on our continent, but given our turbulent history, awareness surrounding good mental health practices and mental illness has not been at the forefront of our fledgling democracy. We have had a lot to deal with. Housing, sanitation, proper drinking water, electricity, all these basic human needs are still being addressed. The implementation of a national healthcare system will also bridge the divide between those who can currently afford private healthcare and those who wait tirelessly in queues seeking medical help. But mental illness does not discriminate. Whether you're rich or poor, the statistics show that 1 in 5 South Africans will experience mental illness at some point in their lives. Africa is still a continent that has limited access to connectivity. The internet has become a support base to many mothers and fathers who have a child born with mental challenges. I know many in the medical profession don't believe in Dr. Google, but if you sift through all the information, some informative, others misleading, you still feel empowered to seek help, find others in your same situation, and find solutions. Imagine giving birth in a village to a mentally challenged child where the nearest clinic is half a day's walk away, with no knowledge of what is wrong with your child. Africa is still challenged by the taboo of witchcraft and ancestral guilt, whereby it is easier to blame the mother or a family situation than to address the problem head-on. But mental illness has always been misunderstood. There is fossil evidence from Neolithic times of trepanation, holes cut into the skulls, perhaps in an attempt to let the madness out. Ancient civilizations were not that much better. Egyptians treated hysteria by applying bodily fluids to the patient and chanting magical spells. The Hebrews attributed madness to a lack of divinity between a person and God. Greek intellectual Hippocrates is being credited as the first scholar to posit that mental phobias were not related to divine intervention or supernatural causes, but rather physical ailments. Mentally ill people were not possessed by the devil. They were not possessed by the devil then, and neither are they now. While Europe was busying itself with witch hunts and burnings, it was the Arabic world that first started the treatment of the mentally ill, with the first psychiatric hospital ward built in Baghdad in 708 AD. The first insane asylum was built in Fez in the 8th century. Patients were treated using baths, drugs, music, and various activities. These Muslim therapies were a stepping stone for Renaissance Europe, who still used whippings and bloodlettings to release insanity, which they believed was caused by committing a biblical sin. Mental illness has certainly had a multifaceted history, from mental asylums, which were certainly more like torture chambers in the 1900s, through to the wonder drug Prozac in the 1980s. From Sigmund Freud, Shakespeare, Oscar Wilde to Ernest Hemingway, our mental illness has been the theme of many a novel or bestseller. Hollywood has also cashed in on our fear of psychosis, and many blockbusters traverse the panic of our hysteria. It is glaringly obvious why we still battle to come to terms with mental illness in the 21st century. Mental health awareness faces huge challenges. There is an acute lack of funding, available to mental health professionals in the public service, public awareness of mental health issues is also still lacking. There are challenges of getting the care out to the people that need it. Regardless of all these hurdles that we face, this is a race that can be won. You are the esteemed doctors, health workers, and supporters of mental health that will take us to the finish line. I wish you luck and fortitude, strength and compassion in your deliberations throughout this conference. Discuss and agree ways forward for the betterment of all humankind.